Well, I'm appreciating what you had to say. I don't know that the answer about kind of how to make the connections from that kind of other end going in towards the schools, but I'm thinking it really fits with what our representative had talked about in terms of kind of these different pathways and sort of wearing different hats and sort of what can we do from this point of view. And so I think it was Thursday evening, I was up in the city of Sammamish and we were having sort of a dialogue like this about similar issues, but we really were talking about this idea of collaborative paths forward. And so I had broken that down for myself into, well, what can we do in the schools? What can we do kind of with and for and as parents and family members? And what about our communities? And by communities, I'm thinking, it's communities of faith. It might be the Boys and Girls Club. It might be the Teen Center. Any way where we come together kind of as groups in our communities, and what can we do there? So certainly cities obviously are part of that. But also then, what about the health professionals? So not one or the other, but I think we all need to on those pathways. And I loved what you said about getting down to the simplicity piece of it. And I think that's sort of what you're talking about as well, even from the professional point of view. It's sort of like, what does it boil down to? Well, listening, making, I think educating ourselves is part of it about what's going on. I don't mean like educating, like getting degrees and that kind of disconnected educating, but what's happening. So listening to people, what they're experiencing. And then that part about relationship, that's so important. Even if it is simply like I say to myself, like, okay, I'm walking in the grocery store and I try to make eye contact with people and say hello, not just young people, but maybe most especially young people, because I think there sort of is a bit of a divide. I think there's kind of always been generational divides, which when I was young, I didn't really think about or understand. But now it's sort of like, wow, I mean, we speak different languages to a certain extent. We have different cultures. And so we need to kind of find our ways to kind of bridge that. So really thinking about that exact question. What can happen from kind of my starting point, and how can I connect up with others? And you just brought back in that piece about like, oh, from the other end, how can that open up? So how could the cities, how could the police, how could, other kinds, the schools, how could they reach out to people who have something to give as well as us offering it?
The youth mental health first aid trainings that are available in our community are fabulous. This is what I wish I had had before we started on this journey. It would have helped me with the vocabulary. Once I took it, it helped really put in perspective what I saw my daughter doing. The point of this, though, was really that part of the mental health training talked about a gentleman, Kevin Hines, I think is his name, who jumped off the Golden Gate Bridge and actually survived. And the thing that was the takeaway for me out of that was he said, if one person had stopped and said, "How are you doing?" I wouldn't have done it. So I have taken that and internalized it in my own life, and I encourage one, take the class because it's incredible. But two, you never know when someone is cranky or aloof or disengaged. I smile at everyone to the embarrassment of my daughter.
She really does. I'm not joking. She really does.
And I will converse with almost anyone for exactly the same reason, because I never know what that might mean or not mean to that person at all. And I don't want to be the person that lets another Kevin Hines go by.
And notably, it's not that it was what you were going to say. I think sometimes we're afraid, well, if we ask that, we don't know what to do, right? We're not qualified. But the fact of it is, he didn't say that then they went on to, provide mental health training on the spot. It was just, or mental health counseling right on the spot. It was, they just noticed me and made the connection and asked how I was. Very simple.
A lot of the information when I started trying to understand my own story, a lot of the information was at a clinician level. And even though, I mean, I have a PhD, but I'm not a clinician, so my knowledge base is in a completely different area. And so when I started trying to understand trauma and anxiety and, all of the symptoms that come out of many different things, I realized that there just wasn't a lot of material available that was not from a clinical perspective. There were memoirs where people told about their stories, and then there were clinicians who told about clients who had been through these types of stories. And so I think that I thought everybody needs to understand this. Everyone needs to have materials where they understand trauma and they understand mental health and mental illness at a very deep level. Because then you are able to help, you're able to run up and get the bassinets from going down the creek, because you know those kinds of discussions to have before it gets to an emergency situation. So that's kind of what I try to do, is to bring that down to a level where everyone, and I think that I really wanted to say this comment after you talked, because I feel like everyone has a place where they can be part of the solution to this problem. And every one of us has to figure out what our lane is and where we can do that. And we got a lot of different lanes up here on this platform. And I think that's a wonderful picture of what everyone is doing to try to solve the problem.
At the end of one of the segments of crisis intervention training that I provide at the Police Academy is a statement that I make to every law enforcement officer that comes through the academy. All too often, the folks that we encounter have had their ability to make decisions and have self-efficacy taken away from them. And obviously in a law enforcement arena, when we're balancing the criminality and the crisis, there is that element of power being taken away. The single most important thing we can do for a person in crisis is to bear witness and listen. It doesn't matter whether you have a PhD or you're a counselor or you're a chaplain or you're Bob on the corner. When you've heard a couple of the panelists speak about the level of isolation and statements like, "I had no clue that anyone else felt like this," or "I had no idea that I was even going through this," that just speaks volumes to somebody that does not have a connection enough to feel comfortable reaching out. So the single most significant thing we can do, regardless of credentialing, regardless of education, and regardless of capability, is to bear witness to someone. Not offer a solution, not be the quick problem solver, not have the best referral, not have the most clients, not run into a building that's on fire, not any of that. It's to sit with somebody and say, frankly, "I am so sorry that this sucks, but we're gonna hang out together and you're not by yourself." And in the course of doing that, whether you're a licensed counselor, where we talk about building that relationship and seeing somebody right where they're at, or you're a hostage negotiator trying to make sure that somebody isn't getting hurt in a building and that hostages or a crisis can be resolved, is to just be with that person.
Well, back in the day, I didn't want to do anything unless I was obligated to, and the only thing the kids are really obligated to do is go to school. Right? And who are they supposed to see for 8 hours of the day? Their teachers. They're not obligated to see their counselors. They're not obligated to see anybody else other than those teachers, to sit in class and to learn. They are the people who you spend the most time with. They're the ones that are going to see your behavior, see changes, see those red flags. And you need to be able to, like you said, feel safe. And I mean, it's just, mental health is such a complex topic, but like you guys were saying, there's such a simple solution. It's just to sit there, ask, are you okay? Do you need help? Can we give you a little bit of wiggle room? Can we sit down, have a plan? Maybe that's change your grade from from a letter grade to a pass to fail, to take off some of the pressure. Anything, literally anything, because so much of what's happening right now is a lot of teachers don't understand the severity of mental health and the things that you need to ask, the things that you need to say. Just, I don't know, maybe in some way providing more mandatory, what's it called?
Teacher training?
That's the one, yep. Yeah, no, it's true. Definitely.
That is my mantra.
Mandatory teacher training, and also like,
Building staff training.
yeah, how are we why is it important to learn math or science or art or anything if we don't feel like living? You know what I mean? You are the only person that can make a difference. You're the only person that can change your reality, but you need help. You need to have those basic learning blocks. How are you supposed to learn and get a college degree if you're so depressed, if you can't go to school? You need to prioritize yourself, take care of yourself first. And teachers can really help and aid that process to make sure that it goes smooth. Well, maybe not smooth, because healing isn't linear, but but smoother, yeah, definitely. I think that a great starting place would be to provide more support for the teachers and to help them train.
I think that that's a giant piece that I'd like to emphasize as a co-responding mental health professional. We ask so much of our teachers, of our police officers, of our firefighters. Obviously, as a first responder, I've got a little bit of a dog in that fight, where what you initially set out to do as a teacher or a police officer or a firefighter has now morphed into so many pieces that integrate in social services, behavioral health, mental health. And when I say behavioral health and mental health interchangeably, mental health is one piece of that, but behavioral health actually encompasses issues with substance abuse as well. So you're asking our first responders, our teachers, to have this element of social work and recognition that many are not taught and qualified to do. But entities like the police academies, the fire academies, and teaching groups are coming in and trying to assert a level of skill and recognition to the individuals that are seeing this, so that then intervention and prevention can be put into place. And I'm a big fan of having the ability to recognize, and I'm an even bigger fan of the folks that would be most privy to seeing changes have at least some recognition, so there isn't a bunch of fear around a student or somebody walking up and saying X, Y, Z to that person and them feeling as though they have a level of responsibility to solve the problem. But then to have the wherewithal to reach out to the folks that would be most effective to help that individual. And that could be a licensed clinician, that could be a peer support specialist, that could be a pediatrician, that could be a counselor, that could be a church group, that could be a youth group, it could be many different things. And having just, there's a reason they call it mental health first aid, having that first aid triage capability is what will take the pressure off folks whose initial jobs were not to do this. I work with cops every day who don't want to be social workers and counselors, but as vehemently as they don't want to be social workers and counselors, they want to help and they want to save lives. So they get the triage expertise, and then they have a co-responder or a mental health professional that they can access in order to get that. Let's get instructors, teachers, teachers' aides, school staff very well aware of what it looks like to triage something, and then the direction in which we point them to make sure that somebody gets the supports around them. Because the worst thing that we can do is have somebody trying to do something in isolation, whether it's a care provider or somebody experiencing the behavioral health or mental health issue on their own.
Well, particularly, as you mentioned, you go to your therapy regularly, right? So
Yes, I do.
So, because that's the other piece of that is, and I'm not saying anything about kind of teachers with any kind of a critical nuance at all. I just really feel like they have not had the training, and it's not what they signed up for, and it's not what they were educated in, and they find themselves where they need it desperately. So how can we partner to provide that, and then also have in place the supports and have them educated about kind of how to connect with those supports, both at the schools and then at the health agencies in the community, or just places where you can be in relationship, as you mentioned, like Boys and Girls Club. I mean, sometimes it doesn't take kind of mental health training in that, right?
I'm a big imagery nerd, and I keep seeing you raise your hand, and I promise I'll ask. How many people are CPR certified? Do you fully believe that you will practice CPR on somebody and then after they're back and breathing, they'll get up and go home? No, they're going to the hospital, right? We're calling fire, or we're getting an ambulance and they're going to the hospital. When we're talking about a level of mental health triage, that's what we're talking about. We're talking about enough to get the person connected to the bigger piece of the puzzle that will help solve the problem. It's very much like that.
Can I just say, as I went through my healing journey and I thought about who helped me along the way and who who failed me along the way. It all came down to one word, which was kind of a part of my story, but the word was flinch. The people who helped me did not flinch. And when I went to talk to them and I went to share my story, they just looked at me and they sat with me. And they did not flinch, no matter what horrible part of my story that I told. And I don't know how many times I told my therapist, you never flinched. You never flinched. I can't believe you didn't flinch. And so I think that, yes, it is the triage. And in part of that triage is that ability to sit with the person and not with no judgment in your mind as to what that is, and to just sit and hold space for them while you get them help.